Joining us now in our newsroom is Dr. Christopher Doring from Franciscan Health, here to talk about the CDC mask reversal recommendations. Welcome. Always great to see you, Dr. Doring.
Yeah, good to be with you, Mary. Thank you.
So a couple things going on. The CDC on Tuesday changed its masking recommendations. There's more concern over the Delta variant, urging vaccinated people in certain areas of the country to resume wearing masks in indoor public spaces. So first question, what do you make of this reversal? Is it the right thing to do? Is it data driven? What do you think's behind this?
Yeah, I mean, I think the fact that the CDC just as recently as a couple months ago had come out and said it's okay for people who are vaccinated to no longer mask, and now here, just a couple months later, changing that recommendation, at least in certain contexts, is a source of some confusion for folks, to be honest. I think at the time they were really trying to emphasize the benefits of vaccination, and there really wasn't a circulating strain at that time that was concerning enough to warrant vaccination by those who've been masking by those who've been vaccinated. That has changed, and that's where, yeah, you're right. Looking at the data, seeing what we're experiencing, particularly with people who are vaccinated, getting and testing positive for COVID at higher rates is the basis for this reversal.
Really, that was my next question. So this Delta variant, even if you've been vaccinated, people can still contract it and then spread it, even if you're vaccinated. This is what we know so far about this Delta variant.
Yeah, we've always known that there's some risk. The vaccine, was 95% protective against contracting the virus. So that low 5% risk of getting the virus, maybe not even knowing it, probably not even knowing it, was acceptable, particularly with the low rates of viral spread in our communities at that time. With this strain, it is more contagious. It does seem to be causing more breakthrough infections, whether they're symptomatic or not. And so, again, I think that's where the CDC is now saying the risk is sufficiently high that it justifies being masked so you don't inadvertently spread the virus without realizing it.
Well, it's interesting because of course, the CDC is responsible for the safety of our country, but it seems as if the surging cases are mostly on the southern border and California, and Indiana is currently in mild or moderate risk of transmission. So how does this apply to our state?
Yeah, I mean, I think everybody's going to make their own decisions. I think the local governments and health commissioners are going to have to sort of weigh this CDC guidance with what's happening on the ground, what our local experiences are. I think you will be seeing more and more vaccinated individuals choosing to be masked when they're going indoors, when they're going to be in environments where they're close to others and they can't guarantee that those others have been vaccinated themselves. And again, masking has primarily always been about protecting others, not necessarily primarily about protecting yourself. And so I think those who are choosing to mask are in effect saying, I don't trust that I'm not carrying this virus, and I don't want to infect someone who's not protected and potentially put their lives at risk by doing so.
And then, Dr. Doring, this is also going to apply to kids K through 12. Kids have had such a hard time, teachers, staff, learning has been sort of affected, compromised. And what do you think of this now, maybe wanting to have this excited coming back to the 2021-2022 school year, and now maybe here we go again?
Well, yeah, I think the here we go again part is, at least with masking in schools, kids are still in school. Kids are still learning in person, and you're protecting not only them and their parents and their grandparents, but you're protecting the staff, the teachers that they're interacting with. So certainly, most people don't want to be masked if they can avoid it. But if what it takes to be in person in school is that we're going to mask, that seems like a reasonable trade-off at this point. Certainly beats going back to home-based virtual teaching.
That's a great point. And what do you think this is going to have, this mask reversal is going to have effect it's going to have on people who are not vaccinated? I mean, it's kind of like, what's the point? If masks are going to be in our foreseeable future, what's the point of getting vaccinated?
Yeah, well, I guess again I view it a little bit differently. I hope what this sort of new information and these new experiences will have is will help to encourage and push people who've been reluctant to get vaccinated to go ahead and do so, because you are so much safer having that protection, even if it does break down on occasion. To be honest, the effectiveness of these vaccines has been so overwhelmingly high and unprecedented with the prior variants that if you compared, even with the Delta variant, if you compared the breakthroughs versus other vaccines like influenza, these vaccines are still incredibly effective at preventing transmission. It's just that we've seen somewhat of an increase. These viruses are more lethal and put individuals at much higher risk of severe illness or dying, and that is particularly the case for those who are unvaccinated.
Hmm. Well, maybe this could be right, sort of that maybe a little extra encouragement push to get ourselves to freedom. And I mean, anything else you'd like to add? I mean, what was there? There was a prediction about 200,000 cases a day, perhaps overwhelming our healthcare systems. I'm sorry, I don't know if I'm right on that number and who had said it, but placing overrun. This is virus is preventable. There should be no more sickness and death in this country. So, what are your thoughts on this overwhelming sense of frustration, perhaps, and overburden of our healthcare system as moving forward with this Delta variant?
Well, I think what it speaks to is kind of the sobering reality that this virus, in all its different variants and forms, is likely here to stay in some form or fashion. But if we can continue to achieve broad levels of protection amongst our population, we can suppress it and restrict it to being a minor illness and an annoyance, as opposed to a deadly pandemic that kills tens of thousands, hundreds of thousands, millions of people. And so I do think even with the variants that are emerging, we are able to safely protect our populations, and the vaccine is certainly the best way to do that. And if we continue to push our vaccine rates up and get that broad-based protection, yes, there will still be some spread of the virus, but it will be rare that it leads to severe illness and death.
Well, I like how you put that. Let's just make it an annoyance. Let's just bring it down to that level of an
Right,
annoyance.
right.
Thank you, Dr. Doring. Always great to see you. Appreciate your insight.
Absolutely, Mary. Always good to be with you.